Hi, everyone. Welcome back to Fem Health. Today, we are talking all things about how women can advocate for themselves in the emergency room setting with Dr. Emily Duym. She is a board certified ER doctor practicing in the greater Chicago area. So, Dr. Duym, in your experience, what are the ways that women can advocate for themselves when they feel like their concerns are not being taken seriously in the emergency room?
That is a great question. I think that one thing that can be really helpful for women is to be very clear and detailed about not just the symptoms they're having, but what is concerning to them about those symptoms. That can sometimes provide additional information that clues the doctor into what risk factors this patient may have that's making their symptom particularly concerning. So, for example, if a woman is coming in with leg swelling, to know why that's worrisome to her, she might say, "Oh, well, I read that what leg swelling could be a symptom of a blood clot, and I happen to be on birth control, and I read that being on birth control might increase your risk for developing clots." So, getting that additional information and hearing from the patient why they are worried about what is going on with their body can be really helpful. I also think it's important for patients to be aware that they can have an advocate with them in the emergency department if they want to. If they want to have a friend or a family member, someone with them at bedside, or even just somebody else in the room. Maybe there's an ER nurse or a technician who they have become comfortable with during their emergency department encounter. They can ask to have somebody else present at any time during the encounter. And sometimes that can create a safer, more empowering space for the patient.
So, Dr. Dime, really good points about making sure that you express the concerns in a way that allows the provider physician to really follow your thought process in terms of why you are concerned about something specific. And that's obviously very helpful when someone is very educated on their disease state, which, of course, some people may not always be, or they may not have any idea what's going on, but they just know something is wrong. So let's say that this has happened, and still the patient feels like, okay, I have said everything in a understandable manner, but still my concerns are not being addressed. What is a second step aside from having an advocate by their side in the emergency room? What's the second step that a patient could they ask further questions that would help? Could they ask to see a different doctor? What are the rules of the ED in that sense?
Sure. A patient can always ask to see a different doctor. Depending on where all of this is taking place, it's possible that there isn't another doctor who is in the department who could see the patient, but it's always worth asking. Patients have a right to change their provider. Um, I also think that if patients ask, what more can I do? What more can be done today? Or if there are not additional diagnostics that could be explored today in the particular setting of the emergency department, where do I go from here? What can I do next? So what kind of physician do I need to make some kind of follow-up appointment with? Can you help refer me to such person? Is there a number that I can call that would link me to the next level of care that I need to further explore this health issue? In the emergency department, it is our responsibility to rule out any pathology, any disease, cause of illness that is presenting an emergent or an acute concern and properly diagnose and treat that. But that doesn't mean that a patient's symptoms will have been completely resolved or even explained in that visit. And so patients should feel empowered to ask, now what? Now that this encounter is over, what's my next step? And that's something that the emergency department physician can walk through in a very detailed way so that patients know what their next steps are.